everyone. As we showcase new leadership in Washington, I am really delighted to introduce you to the new head of the NCI, the National Cancer Institute, Dr. Monica Bertaganolli. Her journey from a family ranch in Wyoming to the top position in Washington at the NCI is so impressive. We are honored to have her remarks today.
Dear members and associates of the Rosalind Franklin Society, I'm quite humbled by the Society's request that I share my story with you as part of the Society's mission to recognize, foster, and advance the critical contributions of women and underrepresented minorities in science. I have to start at the very beginning by saying that I am delighted to do this and will give you a fair amount of detail with the idea that something about my career path will ring true for an individual who might hear this and find encouragement in it. I grew up in Wyoming, a part of the United States that is quite rural, and at the time and still today is an area largely dependent on either agriculture, primarily ranching, or the oil and gas industry for its economy. My parents and grandparents on both sides were sheep and cattle ranchers. My grandparents were immigrants, on my dad's side from northern Italy, and on my mom's from the Basque region of southern France. My parents' ranch was and still is located in the Wind River Range of west central Wyoming. It is a remarkably remote and beautiful place, but 40 miles away from any public utilities and accessed by traveling 18 miles of unpaved road. My siblings and I attended school in a town 95 miles southeast of the ranch. There, we had a second family home that we lived in with my mother during the school week and returned to the ranch on the weekends. And then we lived at the ranch full-time during each summer. For part of the year, winter makes the mountains unsuitable for animals, and so from November to April, the animals were moved to lower pastures, and my dad joined us in town. Ranching is an occupation that involves all family members, and from a very young age, my siblings and I were responsible for work in the family business, caring for animals, maintaining a ranching infrastructure of fences and buildings and water supplies. Life 80 miles away from the nearest grocery store or other modern conveniences requires a family to be adaptable and resourceful. The ranching business is also dependent on many factors that cannot be controlled. A terrible storm could wipe out much of a herd. Prices for feed could be very high when livestock prices were very low. So it was not the most predictable or secure of situations. But my parents were both talented and resourceful, and when they needed to be, lucky. And I had a wonderful childhood in a beautiful and fierce environment. The risks and hardships were well worth it to be able to live life on the ranch. This was a lesson I took forward with me. I am tremendously fortunate not only to have had a wonderful family, but to have benefited from an early life that taught me to work hard, to be resourceful, to be self-sufficient, and to value family above all. There are many reasons that someone would choose a career in science. For everyone, I believe, there's a desire to solve the puzzles that are meaningful for us. And of course, because of the promise that science offers for changing our world. Science was, of course, always my favorite subject in school. All science, math, physics, chemistry, biology. I didn't have a favorite, really, although I had better aptitude for chemistry and biology. During summers on the ranch as a grade schooler, I used to keep a notebook where I cataloged leaves, butterflies, rock formations, lots of things around me that caught my interest. Looking back, I know now that this was the precursor of my laboratory notebooks. My life took a dramatic turn when I was a high school senior. I intended to enroll at the University of Wyoming, where I had a full-ride scholarship. I received a phone call out of the blue from the admissions office of Princeton University. This was in the fall of 1976, and the university was reaching out with a goal of enrolling at least 2 students from every state in the US in its new freshman class. I assumed that they identified me through standardized test scores. I don't really know for sure. They asked me to apply, and I did so by sending in a written application. Nothing further transpired until I received a letter some months later saying that I had been admitted by early decision and even had a scholarship. Incredible. I walked into freshman year at Princeton that fall, having never even seen the campus before arriving. I chose engineering as my major. I absolutely loved being at Princeton. It was hard. I was pretty well prepared, but still had some catching up to do, and I felt a tremendous responsibility to succeed because my parents were sacrificing to keep me there, and because I wanted desperately to live up to the opportunity that was given to me. Chemical engineering was my major, but along the way I took classes in biochemistry and physical chemistry that convinced me I wanted to study medicine. I was accepted by my state medical school, which was the University of Utah, since Wyoming doesn't have a medical school. And my education there was supported by a no-interest loan from the state of Wyoming. Early in medical school, I intended to become an immunologist. The field of immunology was at an inflection point at that time. It was the early 1980s. However, the first time I walked into an operating room, I knew that was the place for me. Almost every surgeon will tell you that this happens to them. I can't describe it. Surgeons are clearly born, not made. I was accepted as an intern in surgery at Brigham and Women's Hospital in Boston. And to my great fortune, the chief of surgery at that time, Dr. John Manick, was also an immunology researcher. And the Associated Dana-Farber Cancer Institute accepted me as a research fellow in tumor immunology. So I was able to both become a surgeon and pursue research in the exciting field of tumor immunology. After completing my training, I took a position at Weill Cornell Medical College in New York. There, I focused my surgical practice on caring for patients with a rare cancer predisposition syndrome known as familial adenomatous polyposis. Families affected by this genetic disorder are characterized by having mutations in the adenoma polyposis coli, or APC gene. And they have a very high risk of colorectal cancer, duodenal cancers, and a kind of soft tissue sarcoma known as a desmoid tumor. My laboratory studied the ways that inflammatory response mediated tumor growth in the setting of APC mutations. This led to a study of non-steroidal anti-inflammatory drugs for prevention of APC-associated tumors, including a large clinical trial for patients at risk for colorectal cancer. I was in New York for 6 years, during which time I married my wonderful husband, Alex, and we had 2 children, Ben and David. In 1999, I moved back to Brigham and Women's and Dana-Farber, continuing to perform surgery for people with complex gastrointestinal cancers and sarcomas. I served as the chief of the Division of Surgical Oncology from 2007 to 2018. My laboratory work continued. However, I also became more active in clinical research. My lab studied biospecimens from patients on clinical trials to identify particular tumor molecular characteristics that could predict successful treatment. This led to another turning point for me, as I decided to focus more deliberately on clinical trials research. An opportunity came for me to lead a large national clinical trials group that was funded by the National Cancer Institute. In 2010, I was elected to be group chair of a consortium known as the Cancer and Leukemia Group B, which today is part of an even larger NCI-funded group known as the Alliance for Clinical Trials in Oncology. For me, this was finally an opportunity to see results from the laboratory be taken all the way to success as a new treatment or prevention method for people with cancers. I'll never forget the wise and wonderful reaction from one of my mentors, Dr. Edward Benz, who was then head of Dana-Farber, when I asked him if I thought I should take on this new job. He said, "Well, if you take that on, you could really make a big difference. Or circumstances completely beyond your control could make it impossible to achieve what you want to do. I think you should go for it." So of course I went for it and spent 12 years leading the most wonderful team of cancer researchers, encompassing those from basic science laboratories all the way to doctors in clinical centers, large and small, executing clinical trials to develop new cancer treatments. One of the things I am proudest of is the ability of this group to do its work throughout the entire United States, including offering clinical trials to cancer patients in my own hometown of Rock Springs, Wyoming, through the work of Dr. Banu Symington, who practices oncology and participates in clinical trials there. This summer, I hit another transition point when First Lady, Dr. Jill Biden, called and asked me if I would be willing to head up the U.S. National Cancer Institute, one of the agencies of the National Institutes of Health. I, of course, said yes to an even bigger opportunity to have an impact on eliminating the harm that cancer brings to us. I am now just in my 6th week on the job. Every day, I am more optimistic about what our agency and our government can do to end cancer as we know it for everyone. Science is a tremendously large field. There are so many fascinating puzzles to solve, and our well-being and, in fact, our survival depend upon the next generation of scientists being willing and able to take on these challenges. The most fortunate among us are those who are able to pursue their love of science and at the same time bring benefit to society. And of course, that means everybody who has the desire to contribute. I am certainly among the most fortunate, and I know this is due in no small part to the advocacy and support of individuals and organizations. In my case, my family, my teachers, who taught me to take risks for a career that I loved. But also Princeton University, Brigham and Women's in Dana-Farber, the National Cancer Institute, and the Biden administration, as well as too many mentors and colleagues to count. What about all the brilliant minds and generous hearts that are out there, but need the extra support, the fortunate break, the special encouragement to make their incredible contributions possible? I would like to thank the Rosalind Franklin Society for embracing the need to do this kind of outreach so that more will be as successful as I have been able to be. In order for society to serve all of us, society needs all of us. Thank you so much.
Our thanks to Dr. Bertagnolli. As she begins her important assignment, we are so grateful for her time. She has been in the office barely a month and really has a huge amount on her plate, and we are so grateful for what she has shared with us today. And now stay tuned as we get a close-up view of opportunities in the private sector as well.